Hello YouTube fans, my name is Rashawn Smith. I'm a physical therapist assistant and welcome to the PTA Life. Before we get started, could you please go ahead and subscribe to my channel and like my video? Thanks. What is physical therapy? Many may find it hard to describe, but chances are you have heard of it before. Maybe a relative or friend has had physical therapy in the past. Physical therapy is such a large profession with many different settings and specialties to be truly narrowed down into one thing. Physical therapy is the education, guidance, training, and physical techniques backed by evidence-based practice performed by physical therapists and physical therapist assistants such as myself to help people regain their functional abilities and to maximize their independence. Physical therapy is a conservative approach which is less harsh than medications and surgeries, and sometimes even preventing surgeries altogether. In physical therapy, you will always be working with people of different ages, backgrounds, and ethnicities to help recover them to their prior level of function. This profession, it brings a great satisfaction of getting to know your patients and to see them on the road to recovery. In physical therapy, there's different types of settings or environments you could work in. These would include inpatient settings or acute care, such as hospitals, where you would be working with people based on their condition from about 1 to 4 weeks. In the outpatient setting, you would normally work with people from about 2 weeks to 3 months based on their condition. In this type of setting, the patients would normally come to you to receive their rehab. Next, you have long-term care, such as nursing homes or skilled nursing facilities. These are where individuals go where they need ongoing care from the nursing staff and from physical therapy. These people are normally the older population. Next, you have home health. This is where you would go to the patient's home and perform physical therapy services. This is for individuals who cannot leave their homes and attend outpatient therapy. Another setting that you have are schools. This is where treatment is provided to students to ensure that they are functional independent in a classroom setting. The last setting that you have is telehealth. This is where you can get treatment over the phone or through video chat with a therapist. Telehealth has grown recently exponentially due to the COVID-19 virus. These settings would be considered the traditional settings in physical therapy. However, there are also non-traditional settings, such as gyms or facilities, prisons, the military. In the military, you could travel overseas and help rehab people in the armed forces. Another non-traditional setting you have are corporate companies, such as large companies like Google or Amazon, where they will have on-site wellness and health clinics and also treat for ergonomic issues. Other non-traditional settings such as sports teams or performing arts groups such as Cirque du Soleil or the Blue Man Group. As you can see, there's a wide range of settings that you can possibly work in physical therapy. Just like the different types of settings, we also have different specialties. We have a wide variety of specialties, which includes, but are not limited to, pediatrics, working with the younger population, geriatrics, working with the older population, orthopedics, working with people who have post-surgical repairs or tears or chronic stiffness or pain. Also, we have the neurological specialty, working with individuals who suffer from strokes or who has ALS, Parkinson's disease, or many more neurological conditions. We also have the specialty of cardiopulmonary, working with people who have heart conditions or lung conditions, such as asthma or heart failure. We also have the sports specialty, working with young athletes or older athletes, and also our weekend warriors, working with the average individual who has their hobbies of playing tennis or running races or also just playing sports in the front yard or throughout the community. Lastly, you have animal rehab, which is an emerging practice where you could treat dogs, cats, rabbits, or even turtles. Lastly, I would like to name a few other specialties such as women's health, men's health, aquatic therapy, and the vestibular system. You can specialize in more than one specialty at a time. Each setting has a different specialty that they are focused in treating. So as the physical therapy profession continues to grow, so will its options in different settings and specialties to treat in. Some of these specialties and settings may be better suited for people based on their different personalities. Some people like to work in a busy environment, some like to work in a mellow environment, some like to work with the older population, and some like to work with the younger population. So to end, these are the type of specialties and settings that you could possibly work in. So if you have more information about physical therapy, or you would like to see any specific topic about physical therapy on my channel, please feel free to reach out to me. You can post a comment below or on the discussion board, or also you can email me at thePTAlife1@gmail.com. And also remember to like my video and subscribe to my channel. Thanks.